my patient. I want to look to see if I see any hazards on the floor, any spills, any cords. Also assess my patient. She's smiling. Her color looks normal for ethnicity. She doesn't appear to be jaundiced, cyanotic. I don't see any tripoding or use of accessory muscles, so it looks like I'm safe to go ahead and proceed. Hi, good afternoon, Ms. Height. How are you today?
Good, how are you?
I'm very well, thank you. My name's Kristen. I'm a nursing student at Palm Beach Atlantic University, and I came in today to do a full comprehensive head-to-toe physical exam on you. Is that okay?
Yes.
All right, before we begin, I'm going to provide some privacy and perform hand hygiene. And then for your safety, would you mind if I check your ID bracelet, please? Thank you very much. Can you tell me your full name?
Gwendolyn Height,
And your date of birth?
3/14/05.
Very good, I have the correct patient. Ms. Height, a few more questions for you that are routine. Can you tell me where you are right now?
Palm Beach Atlantic,
And can you tell me what year it is?
2025.
And can you tell me what brings you in today?
Comprehensive head-to-toe assessment.
Very good. Okay, so my patient is awake, alert, and oriented ×4. I also noticed as she answers those questions back to me, her speech is clear, and she's able to express what she'd like to say. I also noticed that her mood and affect are calm and pleasant. I did not see an allergy band on. Do you have any allergies I should be aware of?
No.
Okay, no latex, shellfish, allergies to environment?
Nope.
Okay, and are you experiencing any pain this afternoon?
No.
Always wonderful to hear that as well. Before I begin, I'm going to give you a short-term memory recall. I'm going to give you 3 words, and then in about 5 minutes, 10 minutes down the road, I'm going to ask you to recall them. So first I'll tell you what they are. They are light, tight, and dynamite. Can you say them back?
Light, tight, dynamite.
Okay, so hold those in your head, and I'll be asking you to recall them shortly. All right, it is now time to begin. Do you have any questions for me?
Nope.
All right, so I'm going to begin with your hair, skin, and nails. I'm going to make my way around to the back of you. And would you mind if I palpate your scalp?
Nope.
Okay, so you'll feel my hands on the top of your head. What I'm looking for are any lesions, rashes, also for feeling for any lumps or bumps, checking the distribution of the hair. She has a coarse texture to her hair. She appears to have good hygiene and is well groomed. Also checking at the nape of the neck and the occipital region, looking for any signs of nits or lice. I don't see anything there. Also noting that this is a bony prominence, so I'm going to check for any signs of skin breakdown here behind the nape of the neck, behind the ears if she wore oxygen or a mask, the shoulders, the scapula, both elbows, exposing the sacrum, and then moving back around to check the heels. In all of those areas, I do not see any signs of early skin breakdown. Next, I'm going to go on, I'm going to feel your temperature, or feel your skin for temperature, warmth, and dryness using the backs of my hands from the top of your head, all the way down your arms to your fingertips, and then all the way down to your toes. And you do feel bilaterally warm and dry, which is normal. At the toes, I'll check for capillary refill, checking for a capillary refill of less than 3 seconds on both feet, which is within normal limits, and checking for edema. I don't see any swelling or edema, but if I did, I'd want to palpate to see if that is pitting or non-pitting. I'm also going to check your fingertips for the same thing, pressing down on the nail bed and releasing, looking for a cap refill that returns in 2 seconds or less, which is normal. The next test you can help me with, it's a test called clubbing. You're going to take your 2 pointer fingers and then put your nail beds together like you're making a small heart. You see that little small window there? Very good, that's a normal finding. That means that there's no signs of chronic low oxygen levels. The next thing I'm going to do is give your arm a little squeeze. Squeeze and release, and the same thing on the other side, checking for tenting. Your skin snaps right back, which tells me that your skin is elastic and you appear to be well hydrated. Do you have any moles of concern today?
Nope.
All right, so if I did, I'd go through the ABCs of moles, but we don't have to do that today, so we can move on. And we're going to move on now to your face, head, and neck. And I'm going to start by just observing her facial symmetry. I don't see any drooping of either side of the face, no signs of ptosis. Moving on to her eyes, I see that her sclera appear white, her conjunctiva appear clear. I see the presence of eyebrows and eyelashes. The corner of her eye is about equivalent with the top of her ear, which is all normal findings. Are you wearing contacts?
Nope.
And do you use glasses to read?
Nope.
Okay, so that means we can go ahead with the Snellen chart. This is the first test for cranial nerve number 2, optic. I'm going to hold this card about 14 inches from your face. You're going to read just the numbers, the lowest line that you can, covering one eye at a time. So if you could cover one eye, go ahead, lowest line you can.
4, 2, 6, 7, 3, 9.
Okay, and then go ahead and switch eyes. Get your vision back. If it's the same line you're going to read it backwards.
9, 3, 7, 6, 2, 4.
Thank you. And it looks like you have 20/20 vision, which is normal vision in both the left and the right eye. The next test of cranial nerve 2 is peripheral vision. So again, I'll have you cover one eye. I'm going to stand directly in front of you. Keep looking at me and tell me the number of fingers I'm holding up.
4, 2,
Good, and switch.
4, 3.
Excellent. Okay, so that is the end of cranial nerve number 2. I'm now going to move on to cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. These are for eye movements. The first test is called the big H. I'm going to hold my fingers at the center of your nose. You're going to keep your head still for me and just follow my finger with your eyes. And as I do this, I'm observing that she has full range of motion of her eyes. She can move her eyes into each of the different cardinal fields of gaze. And I'm also looking for any signs of nystagmus, which would be an eye quivering, which sometimes becomes more pronounced as you move the eyes into their exaggerated fields of gaze. Next is going to be the pupil constriction test. For this test, you can just pick a spot on the wall, look forward. I'm going to shine the light into your eye and look for pupillary constriction. And then same thing on the other side, consensual constriction. Doing it again, direct, letting them recoil, and then consensual. Very good. I'm going to go back to my Snellen card because you don't have a thing here. I'm also going to check her pupillary size. I'm looking to see that they're equal in size and about 3 millimeters in diameter, which is a normal finding between 3 and 5 millimeters. Can you follow your finger, my finger, in towards your nose? Very good. Okay, were you able to see my finger as it moved towards your nose?
Yes.
Okay, I saw that her eyes converge, her pupils constricted. That means that your eyes are pearl, equal, round, reactive to light, and accommodation. One more test here for cranial nerves 3, 4, and 6. I'm going to shine the light at the bridge of your nose. Look where that light reflects back in each eye, and that is -4 strabismus. We're going to round up the eyes. The eyes take the longest with your red reflex. I'm going to use my right eye and put it to your right eye. I'm going to just be looking through your pupil for your red reflex. So again, you can just look forward over my shoulder. And as soon as that light hits her pupil, I can see that that red reflex is present. Same thing on the other eye. Very good. So red reflex is present in both eyes. That's a negative finding for cataracts or something blocking me from seeing back to the back part of your eye. All right. Do you have any questions?
Nope.
Keep going. We're going to move on to your ears. I'm going to start again with inspection. I don't see any drainage coming out of your ears. I don't see any growths on the ears. I'm next going to palpate your ears. So let me know if you have any pain or tenderness as I do these things. Pain?
Nope.
Okay. Next, I'm going to visualize inside of your ear. I'm going to grab a cover and change to my otoscope. Yep. Check that the cover is secure. Okay, I'm now going to pull up and back and then visualize first the ear canal and then the tympanic membrane. Okay, very good. I see that shining cone of light at 5 o'clock. The tympanic membrane is pearly gray and concave. Same thing on the other ear. And the same thing on this ear at 7 o'clock. That cone of light is coming back to me, pearly gray and concave. Last thing I'm going to do for the ears is I'm going to do cranial nerve number 8, which is the acoustic nerve. I'm going to be doing the whisper test. Can you cover your left ear for me? I'm going to whisper a word. Let me know what it is.
Quesadilla.
Okay, another one.
Enchilada.
Very good. Those are both correct. So cranial nerve number 8 is intact. Next, we'll move on to your nose. For the nose, I'm going to start with inspection. First, I'm going to start by looking at your nose. I'm going to be looking at the septum and inside the nose and the mucosa. So go ahead. I'm just going to pull your nose up a little bit and look inside. I don't see any drainage, any epistaxis. Her septum is midline, and I don't see any evidence of boggy turbinates. I would also check cranial nerve number 1, which is olfactory, by having you smell something and identifying it with your eyes closed, one nostril at a time. We'll skip that and move on to your sinuses. Do you have any pain or tenderness in the front of your face right now? All right, so I'm going to just palpate on the top of your forehead here, and then on the sides of your nose, and then underneath the eyes. Any tenderness with that?
Nope.
Okay, so she's negative for sinus tenderness. And we're going to finish here with the mouth. I see that her lips appear moist and pink. I'm going to have you open up your mouth and say ah, stick your tongue out. Say ah, very good. I'm looking at the soft palate, making sure it rises symmetrically. The uvula is midline, her tongue came out midline. Also observing the mucosa inside of her mouth, looking for any signs of thrush or dental caries, and I did not see anything. Next, I'm going to have you tell me those 3 words that I asked you to remember at the beginning of the exam.
Light, tight, dynamite.
Very good, and she's able to pronounce those words as well. With that, I'm able to tell that cranial nerves 9, 10, and 12 are intact, glossopharyngeal, vagus, and hypoglossal. We're going to round up the cranial nerves by doing cranial nerves 5 and 7. First is cranial nerve number 5, which is trigeminal. I'm going to ask you to close your eyes. I'm going to touch your face with this cotton swab. Let me know where you feel it by touch. Thank you very much. Keep going. I'm gonna feel 6 different ones. Making sure I get all 3 nerve roots. Excellent. All right, and the next part of cranial nerve number 5, I'm gonna find the back of your jaw here, your mandibular joint. Open, close, bite down, equal masseter strength. Cranial nerve number 5 is intact. Next, cranial nerve number 7, facial. I'll ask you to smile. I'm looking for symmetry. Frown. Very good. Puff out your cheeks and make a bubble. Don't let me pop your bubble. Close your eyes. Keep them closed. Don't let me open them. Excellent. Cranial nerve number 7 is also intact. Next, we'll move on to the lymph nodes. For the lymph nodes, I'm going to start by palpating. You'll feel me go through 3 different chains of lymph nodes. You can just relax. Starting in the front of the ear at the preauricular, postauricular, occipital, tonsillar, submandibular. Can you push your tongue down? Submental. Sternocleidomastoid muscle, superficial cervical. Stick your neck forward. There you go. Deep cervical chain. And then relax. Posterior cervical chain. And then supraclavicular. Deep breath for me. Thank you. Okay. No lymph nodes are palpable, which again is a normal finding. Moving on to the neck, I'm going to start with the trachea. Just lift your neck up slightly. I'm visualizing that the trachea is midline. It's not deviated to the left or to the right, indicating a potential pneumothorax or neck mass. I'll be now feeling for the thyroid. I don't visualize the thyroid as she sits here, but I will try to feel it by touch. So you'll feel my hand on your neck. Can you look towards your left? Okay, and then coming down the side of the trachea towards the base of the neck, feeling for the thyroid. Maybe feel it just a little bit there, but it's nice and soft. Any tenderness? Nice, smooth. Other way. Okay, so the thyroid is barely palpable. It is soft, smooth, and non-tender, which are normal findings. I'm now going to make my way to your back. I'm going to do one more test for the thyroid. As I make my way around the back, I'm seeing that her AP to lateral chest ratio is 1:2, which is within normal limits. No signs of a barrel chest. I'm going to put my hands around your neck. I'm not going to choke you. Okay, this is one more test to feel for the size of your thyroid. My hands are going to come down the trachea towards the base of the neck, and I'm going to ask you when you're comfortable to swallow. Very good. Okay, so while she does that, I can feel the thyroid rise and fall, and I feel a nice smooth thyroid. It's non-nodular, and any pain or discomfort there. All right, so thank you. That concludes the head, neck, eyes, ears, nose, and throat. We're going to move on. We're now going to check for spinal tenderness. Can you help me by rolling your shoulders forward? And I'm going to find the top of her spine and wiggle all the way down, assessing for any pain or tenderness. Is your spine still there? Rocking down each spinal process all the way until I get to the base, where I will look for the sacroiliac joint. Any pain or tenderness here?
Nope.
Okay. Can you help me find the base of your ribs? Thank you, Miss Height. Very helpful. And then moving up a little bit, some taps on your back. Let me know if there's any pain with this motion. Any pain?
Nope.
Moving to the other side, the same thing. Any pain?
Nope.
Okay, so she's negative for CVA tenderness, no signs of kidney inflammation. We're going to move on to respiratory. We're about halfway, I'd say. For respiratory, you can help me this time. You're going to take some big deep breaths in and out through your mouth. If you get tired or winded, let me know. We'll take a break. Finding again the base of your ribs. Moving up 2 spaces to the 10th intercostal space. Miss Height, can you take a big deep breath in and out through your mouth? Waiting till the end of exhale before moving my stethoscope in a ladder formation. Excellent. And then for time purposes, I'm going to move up to the 6th, over, up to the 2nd, over, into the fossa for the apex of the lungs. And then can you put your arms out like an airplane? Thank you. It's like you knew already. Mid-axillary line, the 6th intercostal space. Mid-axillary line at the 6th intercostal space. All lung sounds are clear to auscultation, which is a normal finding, so we can move on to palpation. You're going to feel my hands grab your back. It's like I'm picking you up off the bed, but you're not going anywhere. Okay, 10th intercostal space, squeezing in and up. Deep breath for me. Excellent. Very good. My hands rose and fell symmetrically, which is a negative finding for a pneumothorax. Next is going to be tactile fremitus. I'm going to ask you to say 99 nice and loud when you feel my hands touch your back. Again, 10th intercostal space. Go ahead.
99.
Great job. 6.
99.
Again.
99.
Excellent.
99.
Arms like a bird.
99.
Great. So using the ulnar surface of my hands, I felt that vibration equally in all locations, which is a negative finding for consolidation. Moving on to percussion, again, 10th space. You can just relax now. You'll feel some taps on your back. Moving over, up to the 6. Second. Arms like a T. Sorry. And one more. Okay, so those sounds are all equal and non-hyperresonant or hyporesonant, resonant, which is a normal finding and again indicates no signs of consolidation. Last, I'd finish up with the right middle lobe, putting my stethoscope in, starting on the right side, moving in a ladder formation, listening to the right middle lobe while she takes deep breaths in and out through her mouth. At this time, I'm going to ask you to go ahead and relax and breathe normal. I'm going to be listening to your heart, starting underneath the clavicle, finding the second intercostal space. So down 1, over the rib, into the second at the sternal border, listening to the aortic valve, moving across the border to the pulmonic valve, down to the Erb's point, down another space to tricuspid. You lift your left arm, midclavicular line, 5th intercostal space, mitral. This is the point of maximum impulse and also the apical pulse. Flipping over to my bell, listening again for lower pitch sounds like murmurs. Okay, that's mitral, tricuspid, Erb's point, pulmonic, and aortic. Okay, I'm going to ask you to lie down. While you're doing that, I'll report my findings. I heard S1 and S2 in all locations. I didn't hear any S3, S4, split sounds, murmurs, or rubs. And I did hear S2 louder in the base, the aortic and pulmonic valve, and S1 louder in the tricuspid and bicuspid valves. I would repeat in a different position because some heart sounds can be positional, but for the sake of this exam, I'm going to move on and listen to the arteries. So lifting, you already know, your nose towards the ceiling, starting with the carotid, listening for bruit, and then moving down. Can you point to the end of your sternum? To the aorta, down and out, renal. Renal. Can you point to your belly button? 45 degrees, iliac. Iliac. Stating femoral. No bruits are auscultated, so I'll now move on to palpation, starting again at the carotid, one at a time for her safety, feeling for strength. And then those are +3. Radial, +3. State femoral, state popliteal, palpating for the posterior tibialis, which is hard to feel through your thick socks. Oh, there, +2. And then dorsalis pedis, we'll say +2, her shoes there. All right, so that completes that portion of the assessment. We're gonna move on to abdomen, starting with inspection. I see as she lays here, her abdomen is flat, it appears soft and not distended. I don't see any hernias, scars, striae. I would then auscultate, but I heard vowel sounds in both the radial and iliac arteries. They weren't normoactive, so I can skip that and move on to percussion. Starting in the right lower quadrant, listening for tympany, using the umbilicus to make my 4 quadrants. All sounds are tympanic. Moving on to palpation. Do you have any pain in your abdomen right now that I should know about? No. Okay. All right, I'm going to start again in the right lower quadrant, keeping an eye on her face, looking for any wincing or grimacing. No pain? No. All right. Next is deep palpation, a little firmer, maybe a little uncomfortable, but shouldn't be painful. Pushing down about 1 to 2 inches and rocking back and forth. No mass is palpable. Next, I'm going to feel for your liver and then your spleen, finding the edge of the ribs. Can you take a big deep breath? Thank you, and release. No signs of hepatomegaly. And then for the spleen, I'm going to reach across your body, pull you up, lay you back, and then go ahead and take a deep breath. Thank you, Miss Hutt. No signs of splenomegaly either. I'm going to help you sit up now, and you're going to hang your legs off the side of the bed. Make sure you're not dizzy. Are you comfortable?
Yes.
Okay, good. Next, I'm going to be testing your strength and looking at observing some of your joints. I'm going to give you a series of commands. I'm going to provide some resistance and just tell you how to move your body, and you just move your body against me. If anything causes you pain, let me know. Okay, I'm gonna start with your neck. So I'm gonna ask you first to look forward towards your chest, towards the ceiling, to your left, to your right. Okay, shrug your shoulders. Cranial nerve number 11, spinal accessories intact. Flop your arms out like a plane. Bring them back towards your body. Bring them out in front of you like a zombie, above your head. Bring them back down, all the way down. Good, bring them behind you like you're skiing. Very good, bring them back forward. Can you touch your scapula with your left arm, right scapula, and switch? And then bring them up like you're laying at the beach. Internal and external rotation are intact. Very good, put your arms out in front of you, flip them over. Curl your arms up like you're at the gym. Push them back towards me. Excellent. Okay, flip them back over, drop your bowl. Good. All right, put your fingers towards the floor, towards the ceiling. Fingers away from each other, fingers towards each other. Squeeze my fingers as hard as you can. Good, grip strength. Moving on to your hips. Raise your thigh towards the ceiling, back towards the bed. Thigh towards the ceiling, back towards the bed. Knees apart, knees together. Moving to the knee. Kick your foot towards the ceiling, back towards the bed. Swing your foot inward, swing your foot outward. Same thing on this side. Towards the ceiling, towards the bed, towards the midline, towards me. Very good. And then for your heels, can you click your heels together, inversion, and bring your heels apart, eversion. Very good. We're going to stop there for now. She had full range of motion in every one of the joints that I assessed, and her strength was 5 out of 5 against full resistance. Next, I'm going to go ahead and check your patellar reflex. You can help me out once you're done there by pulling your hands apart, looking towards that Paige over there, who's my observer, and I'm going to try to find that patellar reflex and give you a little pop. Very good. Same thing on the other side. Excellent. That patellar reflex is intact. Next, we're going to move on to sensory. So for sensory, if you could take out one hand, I'm going to do a series of tests to check your sensation. Close your eyes for me. Tell me where you feel touch, or point to where you feel touch with your left hand. Excellent. Next one is for pain. It's really the discrepancy between dull and sharp. I'll give you an example. This is dull and this is sharp. Close your eyes. What is this?
Dull, sharp, dull.
Great. Next one is for your awareness of space. It's called proprioception. Flip your hand back over. Thank you very much. All right, I'm going to wiggle your finger. I'll give you an example. This is up and this is down. What is this?
Down.
What is this?
Up.
What is this?
Down.
Great. Proprioception is intact, and last is vibration. Tell me if you feel vibration or touch.
Vibration. 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 Touch.
Correct. Okay, so all of her sensory is intact. We're going to skip temperature for today. We're going to move on now to tactile discrimination. Give me one. Extinction. Okay, close your eyes and let me know where you feel the cotton swab touch you. And again. Okay, she was able to feel both sources of touch. That discrimination sense of extinction is intact. One more.
2 point.
Which one?
The 2 point.
2 point, okay. All right, can you hold out your forearm for me? Okay, I'm gonna give you an example. This is 2, this is 1. What is this?
2.
What is this?
1.
What is this?
2.
What is this?
1.
Good, open your eyes. You're very close. That's a normal finding within normal limits, so her discrimination senses are intact. Next is going to be coordination. Give me one.
Number.
Nope.
Oh, not corn.
Rapid alternating movement?
Yeah.
Okay, put your hands on your thighs, flip them over, flip them back, close your eyes, and then speed up. Go, faster, faster, faster. And I'm looking to see that she's coordinated. Oh, I'm not so sure. Okay, very good. Her coordination is intact. All right, we're gonna finish up. I'm gonna ask you to stand up now. Make sure you have your balance. Very good. Can you first start by doing plantar and dorsiflexion? Can you go up on your toes? Very good. And then bring your toes towards the ceiling for dorsiflexion. Okay, she's able to do that against resistance. Excellent. Go ahead and take a walk towards our other observer, Alyssa. I'm observing her gait. She's well balanced. Her arms swing. She's not shuffling her feet. And then come back in tandem, walking heel to toe. You can put your arms up but look forward. Sometimes if our patient has a subtle ataxia, it will be more pronounced when they walk tandem, but she appears again to be well balanced and well coordinated. And then you can stop right there, stand still, Close your eyes, and I would fast forward 30 seconds, seeing if she can stand still without falling over. All right, her Romberg is intact, her cerebellar activity appears to be intact. Last is pronator drift. You're gonna put your hands out in front of you like you're a zombie. Close your eyes. I'm gonna push your hands down, bring them back. Very good. She brought them right back to where they needed to be. Miss Height, you can come on back to bed. What you signed up for today, coming in for a full assessment, is now complete. Do you have any questions for me or anything I can do for you before I go?
No.
Excellent patient. Thank you.